question comes from Cadden B. He says, I think I have a UTI, but I am too afraid to go see my doctor because what if it's not that? I would be so embarrassed. Please do a show with the info. So today our show is going to be all about urinary tract infections. Urinary tract infections are 50 times more common in women because the anus and the urethral openings are so close together, unlike in the male where they are farther apart. So in the female, the bacteria is more likely to start an infection from being so close. For the signs of a UTI, as you will see here, signs to prevent a UTI, drink 2 to 5 liters of liquid a day, preferably water. Avoid caffeinated drinks because they may cause irritation. Cranberry juice will help with the constant flow and keep everything healthy and regular. Carefully examine your behaviors with other people because your intercourse and reactions and relationships with other people may cause a UTI. Women, make sure that you wipe from the front to the back because of the location of the openings. Avoid perfumed toilet paper because this may also cause irritation. Loose clothing is better because it allows for ventilation and breathing instead of being trapped into a constant stage, which will create bacteria. Personal hygiene is also very important. That's how you mainly keep UTIs from occurring because showering and taking care of yourself is the best way to do this. And when we come back, we will do a tutorial on how to wash your hands. Welcome back. We're now going to show you how to properly wash your hands. So first, you turn on your water. Lukewarm is best because it kills more bacteria. You rinse your hands for a while. Then you apply the soap. And while we're saving water, you get it so it's moist enough. With your wrist, turn off the faucet. And in elementary, we were taught to sing Mary Had a Little Lamb or ABCs. Just make sure you do it long enough that you can get all the things off, and you might want to apply pressure while you do this. Make sure you get in between all of your fingers and under your nails because bacteria may be waiting there, especially for you ladies, when you apply personal hygiene items, which we will talk about in a minute. So after you have applied your soap, turn it back on with your arm or your wrist and rinse your hands off. Make sure you get all the soap and usually wash up to your wrist so that it's cleaner. Turn the faucet back off and dry your hands. That's how you properly wash your hands. And then ladies, for your personal hygiene, when applying tampons, this way your hands are clean. So when everything goes in, it is clean and you'll prevent a UTI. Also, when you are taking your tampon out, make sure that your hands are clean because that may also cause an infection and that's bad. And make sure you're regularly changing your tampons. Same with pads. All of the stuff will accumulate here and that is very dangerous because everything's sitting there in the same thing and it may gather. So make sure you're constantly changing all of your personal hygiene things, and when we come back, we'll talk about signs of a UTI. Welcome back. So like I said, we're going to talk about signs that you will know if you have a UTI. There is painful urination. Most cases are reported with a burning sensation, and there is a frequent urge to urinate, but it is difficult to start the process of urination. That is very key in it. You will usually have chills with a fever, nausea, and vomiting. So make sure if you have any of these signs, you go and see your doctor. Because even if it's not a UTI, it's always good to go and get checked up. So some things that may happen if you do have a UTI or if you don't go to the doctor. A urethritis is when the infection is trapped in the urethra. A cystitis is when it moves down into the bladder. And pyelonephritis is when it moves to the kidneys. For men, prostatitis is when it is an inflammation of the prostate, and it usually goes along with the UTI. For prostatitis, you will have fever, swollen and tender prostate, and how they will help you with that is they will give you broad spectrum antibiotics. Chronic chronic prostatitis is asymptomatic, means you will not have very obvious symptoms, but the most obvious is irritation during urination and or difficulty urinating. If this happens, you may have to have surgery, so we don't want that to happen. But UTIs are usually caused by E. coli, which is a normal bacteria in our body, but when there's an excess of it, then it becomes an infection. Antibiotics will cure it because it is a bacterium. But once you stop taking your antibiotics, there's a chance that it may reoccur, the infection. So make sure you stay in touch with your doctor and get your regular checkups. And again, if you have any of these signs or symptoms, make sure you go see your doctor. Thank you for tuning in.